Hello friends, welcome to this session. We'll now learn about pharmacology. This session is Introduction to Pharmacology. This will help us to first understand what is pharmacology. We'll talk about the importance of pharmacology as an undergraduate student, what are its various branches, how you should study pharmacology for your theory exam, for your practical exam, as well as for your PG entrance exam. What are the important topics to focus on? Then what books you must refer to, how you should devote your time to pharmacology, and how does DigiNerve help you in this endeavor. So coming on to first the definition of pharmacology. Pharmacology is derived from the word pharmakon, which means drug or poison. And the second component of the word pharmacology is logon, which means science. So therefore you can define pharmacology as the science of study of substances which are used to prevent, diagnose, treat disease or alter physiological state. Now this definition of pharmacology encompasses everything. It talks about use of this specialty to diagnose a disease. Like we are aware about Tenisolone test, which is used to diagnose myasthenia gravis. It is used to prevent diseases. We talk about vaccines. We talk about prophylactic treatments. For example, isoniazid in contacts of patients with tuberculosis. It talks about treating a disease. For treating a disease, we have antibiotics. We have anti-inflammatory agents which help you to treat a disease and also to alter physiological state. Here we refer to alteration of physiological state, especially in women. For example, preventing pregnancy, suppressing lactation, and so on and so forth. So this is a science which deals in all the aspects of a disease, right from diagnosis to its treatment, to its prevention, to alteration of physiological state. So therefore drugs or therapies which are used in normal people as well as therapies which are used in patients having a disease. So whenever we talk about pharmacology, please remember you can get a note on pharmacology on any drug. So please remember this basic thing, that whenever you get a note on pharmacology, you need to concentrate on 10 points. The first point is about the history. If you are asked to write a note, so you must talk briefly about the history, how it was discovered, what is the source of this particular drug. Okay. You should talk about the sources, physical and chemical characteristics, if you can remember, the mechanism of action. How does this drug act? And then how does the body behaves with this drug? How does this body changes the drug, that is pharmacokinetics, which talks about absorption, distribution, metabolism and elimination. It also talks about what are the effects on biological processes in the terms of changes in the biochemical processes, changes in the physiological processes, and what are the other effects which are there. Now please understand, this chemical nature is related with understanding the mechanism of action. It is also related with pharmacokinetics, that is, a drug is lipid soluble, water soluble, high plasma protein binding, low plasma protein binding, eliminated or metabolized by the kidney or by the liver. And based on that, you can determine what are the biochemical effects, pharmacological effects or physiological effects. And from these effects, you can derive what are the beneficial effects and what are the unwanted effects. The unwanted effects among these would be labeled as adverse drug reactions. And if given in larger dose, this would result in toxicity manifestations. And based on this nature of action, whether pharmacokinetics or pharmacodynamics or physical characteristics, it carries a risk of producing drug interaction. So there could be a food and drug interaction, there could be adsorption onto the drugs, there could be pharmacokinetic interactions, there could be pharmacodynamic interactions. This would be made clear once we look at various important topics. So just understand, these are the few terms that we will be talking about. And then based upon these effects, there would be certain disease states where a particular therapy or a particular drug would be contraindicated. And lastly, based on its usefulness, pharmacological actions, where it is beneficial, you need to understand or enlist the uses of this particular therapy. Last but not the least, if possible, also write the therapeutic status, whether it is a drug of first choice, drug of a second choice, or a reserve drug, or as a last resort drug. So these 10 points are very important for you to remember, that whenever you get any question on a drug as a note or describing about characteristics of a note, if you remember these 10 points, you will never miss out on getting a score, because once you are writing about these 10 points, all the components of the drug would be taken care of, and obviously it would be adequate sized answer to get you a good score, provided what you're writing is correct. So coming on to the history of pharmacology, pharmacology is as old as 300 BC. The first references to the use of various preparations for the treatment of human beings is as early as 3000 BC, which are given in the Rig Veda, which has around 1000 herbs and plants which have been used for medicinal purposes. Then in 2735 BC, we have Chinese Materia Medica, which talks about the various herbs and the plants to be cultivated and how to be eaten as pot herbs. Then the next references are from Ayurveda, which are written in another Ved which is called as Arthveda. It has a number of methods for preparation of drugs, using minerals, using herbs, different concoctions based on different procedures which are there, which is a science in itself. And then in 1500 to 2000 BC, we have Egyptian literature which talks about medicines with about 160 plants which are there, and these also used some metals as a part of therapy. And lastly, we have Hippocrates, who is also called as the father of medicine. He has number of contributions to our medical science. He is the one who came up with the concept that the disease stems from natural causes. Earlier, before that, everybody had this impression that a disease is mainly because of ghosts, because of some other variations which are happening over. He was the first one to explain that diseases do happen due to natural causes. He also talked about medical ethics. All of us have taken a Hippocratic oath at our graduation. So this is a contribution from Hippocrates to our profession, and therefore he is rightly said as father of medicine. Then Galen in 3rd century experimented on sections of spinal tract, and he was able to clearly depict that if a section occurs at this particular part of the spinal cord, this function is going to be lost. He mainly experimented on pigs and gave us a number of insights into the central nervous system. He also prepared preparations which are called as Analytical preparations, which had a polypharmacy and included plants and animal components as a drug. Then we had Paracelsus in 1493 to 1541, who established a link between a chemistry and the medicine. He was the first one who used simple chemicals in treatment of disease. For example, use of mercury in syphilis. So presently, nobody is going to agree to allowing you to use mercury in a patient with syphilis. There are so many effective treatments, but earlier in that days, during his time, there was no treatment available. And when he started using mercury over there, it really made a difference, and it was a big revelation. Then Oswald Smithberg is said to be the father of pharmacology. He was the first professor of pharmacology, and he largely dealt with the chemicals and poisons resulted or affecting the heart, resulting in vomitings and passing urine, as well as hypnotics, venoms. So he was the first person who started using these varied substances available for the treatment of the patients. John Jacob Abel is said to be the father of pharmacology in US. He is the one who isolated a chemical called epinephrine, which was responsible for causing increase in the blood pressure. And he is said to be the father of pharmacology in US. And Paul Ehrlich is said to be the father of chemotherapy. He was the first person who developed arsenic based therapy for use in patients with syphilis. He talked about the use of, or he was the first one to propagate the use of methylene blue, and he's rightly said that he is the father of chemotherapy. Then from India, we have two important stalwarts which we just need to remember. One is Colonel R.N. Chopra. He's said to be the father of pharmacology. He is the one who developed pharmacology in India by bringing up a compendium on herbs which have medicinal values, as well as also legitimized or gave evidence for the use of traditional medicine or indigenous drugs in various diseases. And lastly, we have UK Seth, who is said to be the father of clinical pharmacology in India. He is the one who pioneered experimental and clinical pharmacology. He is credited with setting up with the first clinical trial unit in the country, and therefore he is rightly said to be the father of clinical pharmacology in India. Now coming on to the basic concept in pharmacology, the whole concept in pharmacology is with the drug. Drug is derived from the word drugge, which means dry herb. So any substance or product which is used to modify or explore physiological systems or pathological states for the benefit of recipients. So this is the WHO definition of a drug. So please understand these words very carefully. Any substance or a product which is used to modify or explore physiological systems. So here it is talking about diagnosis, it is talking about modification of physiological system. For example, suppressing menstruation, delaying menstruation, lactation suppression, and so on and so forth. And similarly also exploring as well as modifying pathological states, that is nothing else but disease. It talks about prevention, talks about treatment of these particular pathological states. These days, the word drug is more of associated with substances of abuse. So the word we commonly use these days is medicine. So medicine can be defined as a chemical substance. Now please understand these words very carefully. A chemical substance used in minute quantities for the diagnosis, prevention, treatment and cure of a disease or pregnancy. Now please remember, pregnancy is not a disease. Pregnancy is a physiological state. Therefore, these chemical substances, in addition to doing any of these four functions, are prepared in accordance with standards laid down in the book which is called as Pharmacopoeia. Pharmacopoeia is the book which you refer to in the court of law in case you have to describe anything about the drugs, how it has been prepared, what are the various characteristics, and this is a very authenticated reference which is used. So medicine could be a drug or a combination which is presented in a dosage form which could be meant for humans, for animals or for plant consumption. It is usually commercial. These days we no longer have a pestle and mortar or a pill making machine over here, or we try to make powders putting up over there. So we have a commercial preparation which are already pre-marketed, very well packed and made available as per the regulations of the regulator of the country, that is the Drug Controller General of India, that is DCGI. And at times could also include free distribution. For example, we have many programs of Government of India for the distribution of contraceptives, for the distribution of iron preparations, for the distribution of vaccines, Mission Indradhanush, chlorine tablets for water purification and so on. So medicines, they usually contain at least one active ingredient. So if it is a fixed dose combination, it will have more than one active ingredient, and it also has inert excipients which can turn out to be toxic. There are numerous examples in the literature which talks about how when one excipient was changed, it resulted in toxicity. Classic example we talk about is phenytoin toxicity when its excipient was changed. As a result of which, so one needs to understand very carefully in case there is a change in the formulation, as simple as a change in the color, change in the excipient, change in a binder substance or any such change, and if there is any signal or there is any data which talks about increase in particular events happening after drug administration, one must rarely look into the cause, as probably it could be because of change in these excipients. So I talk about important subdivisions of pharmacology. We have pharmacodynamics. Now as I said, we have the Newton's third law which says that to every action there is equal and opposite reaction. So once we are going to administer a drug, there are two things which are going to happen. One thing is this drug is going to affect the body. These changes which the drug produce on the body, they are called as pharmacodynamics. The second is pharmacokinetics. These are the changes which the body does to the drug. So once a drug is administered, it undergoes a process of absorption, distribution, metabolism and elimination. It could be excreted, and as a result of it, there is termination of action. So that part, what the body does to the drug is pharmacokinetics, what the drug does to the body is pharmacodynamics. Then we have another branch which is called as toxicology. As the name indicates, toxicology refers to study when drugs have been administered inadvertently or accidentally, or there is intentional poisoning in large amounts. So these are the magnified effects which are happening or which are dose related. Pharmacy talks about the method of preparation of a drug, how to prepare. For example, you are making a tincture, how to prepare a tincture. You are making a solution, how to make a solution, how to make a powder, how to make up a linctus, a cough syrup, oral rehydration powder. Pharmacogenomics talks about the effect of genes on responses. We already are aware that those people who have G6PD deficiency, they are prone to develop hemolytic anemia if they are given primaquine. Now this study is the basis of pharmacogenomics, and recently now we know there are certain genotypes or there are certain alleles which predispose us to either a toxic effect, or we'll talk about whether this drug would be effective or not. A toxic effect, we talk HLA-B1502 allele, if present in Southeast Asians, increases the risk of Stevens-Johnson syndrome with carbamazepine. Similarly, CCR5 expression talks about whether the anti-HIV drug would be effective or not. CCR5 is a marker which is used for seeing whether the entry inhibitor miraviroc would be useful in patients with HIV or not. Expression of HER, if positive, would an indication for efficacy with trastuzumab, which is effective in carcinoma breast. So these advances which looks at either selection of a therapy based on certain genetic markers or predicting of risk of serious adverse reactions which could be fatal, again on the basis of some changes or some markers in the genomes, and they would again help us to make the medicines therapeutically effective as well as safer for these patients. Then clinical pharmacology, now this is quite opposite to what we do in practice. So what we do in practice is we have a patients who are coming to us, and for the patient who is coming to us, we select a drug which is out of million drugs which are available. For example, let's say the patient has pain in the knee. So it means we have to use a non-steroidal anti-inflammatory drug. We could use as simple as paracetamol, which will also give a pain relief. We can use ibuprofen, which causes relatively lesser gastritis. We can use diclofenac, which achieves a higher concentration in the bones as well as in the tissues over here, and therefore it could be effective. So here we have the patient who is the main focus, and we choose among the various drugs which are available to us, which will suit the needs of the patient. In clinical pharmacology, it is the reverse. We have a drug which we want to evaluate. So out of all the patients who have come to us, we will see that which patient would be best suitable to study these effect. So a patient, for example, we are trying to check for an ACE inhibitor. So this angiotensin converting inhibitor, that is going to be, we are going to be doing the clinical pharmacology for that. So therefore we would be selecting a patient who is having history of hypertension if we are looking at antihypertensive effect. We would try to rule out those patients who have renal hypertension, those who have other renal conditions, because we know that ACE inhibitors will cause worsening in those patients. So we just want to look at therapeutic efficacy first. This we already know it will cause worsening and cause a paged kidney. So therefore we would not take people with that. We could take people of either gender, a male or a female. We could see what is the effect. We could take adult population. So anything who is more than 18 years of age but less than 65 can be taken up over here. But the important criteria would be hypertension, any age, any gender, maybe any race also. But the excluding point would be that this patient may not have other comorbidities, should not have a renal dysfunction, because that would make the chances of having adverse effects to ACE inhibitors much more. So when we look at clinical pharmacology, we are evaluating a drug, we have to select a patient for that particular drug. When we are doing practice, we have to select a drug for the patient who is coming to us. I hope the difference between clinical pharmacology and practice is clear. Now, pharmacology is one of the most important subject which is there in medical science. It is not that because I am a pharmacologist, it is there because you go to any specialist. Any specialist, if you have a disease, if you don't have a disease, if let's say in this era for COVID, you are going to a doctor, you're not having any manifestations, but there is already COVID, which is as a pandemic, you would be advised to undergo a COVID vaccination. What is a vaccine? Vaccine is again a drug which is used for prevention of disease. For example, you have a medical problem, you have fever, you would go to a medical physician. So he would evaluate you, look for if there's a bacterial or a viral or a fungal or whatever cause is there, and will prescribe you with a drug accordingly, which could include a paracetamol, which could include an antibiotic, which could include an antiviral, it could include an antiprotozoal. In addition to this, he or she might also be prescribing some proton pump inhibitors or H2 receptor antagonist or some other therapies which are there. You have a surgical problem, you unfortunately have an accident, you have a cut. So you would be injected with a local anesthetic, xylocaine or lignocaine, and the suturing would be done. Lignocaine is again a drug. You might have acute appendicitis, so you will require surgery, so you will be given a pre-anesthetic medication which is again drugs. You will be put under anesthesia using various drugs. You would be recovering out of anesthesia and you will be given drugs for post-operative pain. So all these therapies, whether they are medical, whether they are surgical, look at lab sciences. You have a renal stone, you're going to get a contrast based study done. So contrast is nothing else a drug. You look at any therapy, you look at any specialty, every specialty uses pharmacology component one way or the other, either to aid diagnosis or to cause prevention or to treat a cause or to alter physiological state. Now pharmacology, when you're going to learn in the second prof, it is built upon the knowledge of anatomy, physiology and biochemistry. Why anatomy? In pharmacology, we're going to teach you how to give an IV injection. If you know from your knowledge of anatomy, where are the veins situated, how to look for them, how to make them prominent, only then you will be able to anatomically identify them and inject it. The physiology tells you there's a blood which is running over here. So therefore, whenever you're going to draw in a needle, it has to be given at a 45 degree. You have to first withdraw the plunger to confirm that the needle is in the blood vessel, and then you slowly inject it. It looks at biochemistry. You're giving insulin to a patient. We know that once we give insulin, the blood sugar levels are going to fall. There's going to risk of hypoglycemia. You're giving an antithyroid drug. The antithyroid drug will cause suppression of T3 and T4. You're going to give thyroxine. Thyroxine will increase your T3, T4 levels. You talk about antihypertensive. Antihypertensive, you know that you have to measure blood pressure, which you have learned from physiology. It is a technique that you look at, and therefore it tells you how to evaluate a drug therapy. You are using a beta blocker which causes bradycardia. Physiology has taught you how to look for pulses. Anatomical position tells you where to look for it, and therefore you know that pulse is being monitored. This is before using beta blocker, after using beta blocker, and you see whether there is reduction in heart rate or not. Remember, pharmacology adds a component in all specialties, because no matter what specialty is, whether it's a lab science, whether it's a surgical science, whether it's a medical science, everybody is going to use a drug, and the knowledge of drug comes from the branch of pharmacology. Remember, there's no treatment without pharmacology. Even when you're giving some aid, for example, you had a hernia surgery, putting in a mesh over there. You have a complete heart block, you're having a pacemaker put up over here. Everything, device, drug, everything is nothing else but pharmacology. So please remember, so it is pharmacology is an integral part of all specialties. Please try to understand pharmacology. It is relatively dry subject, you get a bit bored, but there are ways to make it interesting. So in pharmacology, as per the CBME curriculum, which is competency based, started since the admission batch 2019, it has 64 competencies and there are 21 skills. These competencies and skills are going to be covered in lectures. There are going to be group discussions, there are going to be self-directed learning sessions, there are going to be some integrated topics where we will use inputs from various other departments, from preclinical, that is anatomy, physiology, biochemistry, going on to the horizontal integration with pathology, microbiology, pharmacology, community medicine, and also with the other sciences, eye, ENT, gynae, medicine, surgery, dermatology, and so on and so forth. We'll also be learning about these skills in various practicals which is there. So just try to look at, this is a snapshot of what is the competency table look like. You don't need to understand it in detail, but just try to see if you get a chance to look at it. It is given in the volume 1. So here it talks about the competencies in pharmacology, that is PH 1.18. So therefore, if you look at our lectures in DigiNerve, you will find that they start with that this covers competency this and this. So it talks about, let's say, pharmacology 1.3, it talks about enumeration and identification of drug formulations and drug delivery systems. So there, this could be in the domain of knowledge or skill. Knowledge is, you might be asked, it means, so when it is going to be evaluated, it could be evaluated as written or viva voce. So you could be asked in theory examination, okay, write a short note on IV route of administration or on a meter dose inhaler. Same thing could be there in your practical examination, where you are asked to demonstrate the administration of a drug using an IV injection, or demonstrate to a patient or communicate to a patient that how would you use this meter dose inhaler. Level which is going to be there, it's going to be talking about nose or nose how, nose and nose how is going to be in theory, shows how is going to be in practicals, and performs independently, again it's going to be in the practicals which is there. And definitely this is a core area, okay, and it could be covered in lecture as well as in practical. So your teachers in the demonstrations might be demonstrating you various routes of administration, they might demonstrate you various formulations, or they might give a description of these in the class. So it could be done as a theory, it could be done as a practical, and similarly it could be evaluated both in theory as well as in the practical. In addition to these competencies, there are 2 modules. One is on attitude, ethics and communication, called as ATCOM. There are 8 modules which are to be covered in approximately 37 hours. And the second is on pandemic module, which is mandatory, which talks at present about COVID, use of personal protective equipment and so on, and therapies which are there for the treatment of COVID. In your theory examination, in the university examination, you would be getting 5 marks question on ATCOM. So it is very important that you also lay emphasis in talking or in reading about ATCOM, these 8 modules. Then when you are in the department, because already the schedule as per the NMC guidelines is made available on the website, and obviously this will also be put out in the department display boards or notice boards and outside the lecture theatres, so that you know what is going to be covered up in the next week. And please, it's always going to be helpful if you read up the topic beforehand. Remember, punctuality is very important, because if a teacher is taking a class, you walk in the middle of a class, it not only disturbs the teacher, it disturbs the other class fellows also, and you would not know where the teacher has started. You will be missing out on some component. And remember, when you are in pharmacology or in any class, there's going to be a continued assessment which is there, and it is very important that you get assessed. This will not only help you understand whether your topic is understood to you or not, because this will be based on the scores or the answers that you are giving for a particular questions being asked over here, but this will also add up to the internal assessment. Briefly about internal assessment. So in every subject there's going to be internal assessment for 100 marks which is there. So this could be based on your theory as well as on your practical. In theory, this could be daily or weekly assessment depending on your institution. It could include marks which you obtain in various tests, in terminal examination, in send-up examination, as well as in various group discussions. Similarly, based upon your record keeping for the practicals, in the self-directed learning sessions, in integrated sessions. In addition to this, though you have to have at least 75% attendance in theory and practical, this is not contributing to your internal assessment. Obviously, it will help you to have a better understanding of the subject and help you to get a better score in internal assessment. Also, there's a component of behavior and attitude during your working in the department, whether you're in the lab, whether you're in the class, whether you're responsive to the answers, whether you are diligently carrying out the activities which the teachers have assigned to you or not. Remember, in order to appear in the university examination, you require 50% internal assessment in theory and 50% in practical. Now coming on to how to prepare for exam. Remember, there are going to be two papers in pharmacology, paper A and paper B. Each of these papers are going to have 100 marks each. So 100 marks for paper A, 100 marks for paper B. This paper would have different components. So not like your seniors before 2019, where a question paper was a different format. Here you will have different components. These components include a long answer question which could be a problem based. You could be given a scenario. For example, you have a patient who had a sudden fall and there is a tonic-clonic movements of the body. There was frothing from the mouth. The patient had loss of urinary and bowel control. Patient was unresponsive. After some time, the patient was a bit drowsy and groggy, and then when you woke up the patient was responsive. So what does this patient have? So obviously this is a description of a patient who had a generalized tonic-clonic seizures. So the question would not give you diagnosis. It could be asking you about enumerate the drugs which could be used in this patient presenting with this manifestation in emergency. How would you manage a patient who is presenting you with continuous tonic-clonic convulsions, which could in other words mean that you are being asked to describe the management of status epilepticus. You could also be asked about, in the same question, write a short note on one of the drugs which are used in the treatment of this disease. So this question could be for 10 marks or 12 marks, and there could be breakup over there. There could be a short answer question which could be ranging anywhere between 2 marks to 4 marks to 5 marks or 6 marks. So it could include questions which are asking to you about explain why, compare and contrast, give the pharmacological basis of the use of, write a short note on, explain the rationale of combination of this particular therapy or why this combination is not used, and so on and so forth. So please, once you get a question paper, please see how many marks are allocated to that question, and then you start writing or planning that answer. And remember, they could also have a component of multiple choice questions. This will vary from institution to institution, but they could never be contributing more than 20%. There could be 10 questions of 2 marks each. There could be 20 questions of 1 mark each. There could be 5 questions of 2 marks each. So each university will have different set of rules, but it would not be more than 20%. Please remember that when you are going to have this examination in the theory, 20% of these questions are expected to test your knowledge. 20% would be talking about comprehension. 20% of these questions, they could be for the application of various principles that you have learned in pharmacology. 20% would be for analysis. You might be given a scenario which you have to analyze. 20% would be for synthesizing a plan, and 20% could be contributing to evaluation of a given scenario to you. There could be a slight variation, slight above and below in this, but remember, this is going to look at higher levels of cognition. The simplest is knowledge, and the most highest is that of evaluation. Remember, all the components or topics in pharmacology would be evaluated, and there is something called as blueprinting. So for 100 marks in each paper, 95 will be attributed to pharmacology and 5 marks will be for AdCom, as I've already explained. Similarly, in practical examination, there could be, as I said, there are 21 skills which are enshrined in this competency based curriculum for pharmacology. So you could be, depending on your institution, you could have spots, or there could be a spotting which could be referring to, you could have to identify a dosage form, you might have to write uses or disadvantages of a particular dosage form. You could have to do a dose calculation. You might have given a scenario, you have a patient who is presenting with fever, chills and rigors, okay, and PBF shows that MP or malarial parasite is positive. You are provided with this preparation of chloroquine. For this child, prescribe who is weighing 10 kilograms. So you have to now remember that what is the dose of chloroquine, what is the loading dose, what is the maintenance dose over here, and there you have to calculate based on this. So this could be there as a part of your spot or exercise during spotting. There could also be an ADR picture which you have to identify what is the ADR, what is the possible drugs which could have caused up over it, could be given with a scenario. There could be a therapeutic problem. It could be presenting as a contraindication. For example, you have a patient who has COPD and is prescribed theophylline. This patient also has fever, so the consultant has also prescribed ciprofloxacin. So whether this treatment is rational or irrational. Now remember, we do not combine a fluoroquinolone with theophylline because it increases the theophylline levels and produces toxicity. You could be asked about a combination which is given up over. For example, you might be given a preparation which is containing amoxicillin and clavulanic acid. You could be asked, is this rational? Or you could be given a tablet of primaquine and asked what investigation do you need to do before prescribing this. That is, you have to look for G6PD levels. Or you could be asked a contraindication. For example, there is a patient who is allergic to penicillins, and there could be cephalexin as a tablet which is given up over here. Would you give it over here? Because you remember, if the patient has allergy of penicillin, there is a chances of cross allergy with cephalosporins. Or you could be asked about that, name the toxic metabolite. So there could be paracetamol tablet over here where you would have to write that is NAPQI. Or there could be a preparation which is containing cyclophosphamide and the toxic metabolite is acrolein, and so on and so forth. You could be asked a prodrug, what is the drug which will be performed or which would be available from this prodrug. For example, you have levodopa, so it will be active in the form of dopamine. Then the second type of questions which would be there in the practical is on skill stations. So these are very important. These have now been added up since 19 batch which is come to up. So in skill station, you might have to demonstrate route of administration, IV administration, intramuscular, subcutaneously. So you might have to administer on a mannequin or a given situation which is there. There could be about communication skill where you have to communicate how to use a transdermal patch, how to use a meter dose inhaler, how to give a subcutaneous injection with insulin. So you'll have to demonstrate, you'll have to explain to the patient, you have to see how you will be evaluated on a checklist, whether you are greeting the patient, you are explaining the diagnosis, you are explaining the treatment options, you are explaining the cost of the treatment, you are explaining them these are the options and which one would you prefer. You are explaining to them that how you are going to use this. So each of these are going to have points over here. Then if it is a chronic therapy, what is going to be the monthly cost for this particular treatment? Whether there is going to be chance of dependence, how are you going to dispose of this particular device which is there, what are the other precautions that you take, what are the food drug interactions which would happen, what are the drug drug interactions which could happen. So this encompasses 10 to 12 points for each of these which the student is to communicate either to examiner who will act as a patient, or there could be a volunteer to whom they have to be explained, and obviously this is usually in the form of a checklist and you will getting a score on it. Or you could be asked to prepare an oral rehydration solution. It could be provided to you as a packet over here, and there would be water, there would be a marrying cylinder, and then you'll have to demonstrate how to prepare oral rehydration solution from the powder for ORS. The third component in your practical could be analytical texting skills. So you might be given a prescription, you have to analyze that prescription. Whether it's a prescription, what are the faults in this prescription? So for that you need to know what are the parts of a prescription. You could also be given a drug promotional literature which you have to review, that whether it is a good drug promotional literature as per the WHO guidelines or not. You could also be asked to make an essential medicine list from a group of drugs, or you might be given a scenario that okay, you're posted in a primary health center and you have to make essential medicine list. So depending upon how you identify which area you're living in, what are the healthcare problems and what are the various drugs that you require to adequately treat patients of that population at all times. Or you could be asked to compare the cost of metronidazole and tinidazole in a patient with MBPhS. So you will be given the cost of this treatment and then you have to do a pharmacoeconomic analysis. Or you might have to give a P drug or a preferred personal drug which is there for treatment for hypertension patient who is also having diabetes mellitus. You also might have to do a ADR reporting for a scenario. You might be given a description that this is a patient given a drug A, developed a maculopapular rash, and patient was given an antihistaminic and then the drug was stopped, and after 3 days the rash decreased, and now you have to write a narrative and fill up this ADR reporting form which is there based on the scenario which is given to you. And lastly would be a performance station where you will have to write a prescription for a given scenario which is there, or you might do a computer assisted learning or assessment association. You might be given a graph which is there, you might be shown a video of a tachycardia, of a tachyarrhythmia, bradyarrhythmia, changes in the blood pressure which are being visible over there, or responses which is there. So this you will have to demonstrate, or this you will have to explain that what is happening in this particular scenario which is there. So this was all about practical. Remember, there is not supposed to be any specific viva for it, but in institutions or universities there might be variation. The viva is supposed to be only for this practical component. It's not like your seniors where there used to be a dedicated viva voce on theory. Viva they can have it on sports, viva they can have it on skill station performance which is being done over here. Viva could be on analytical skill stations which is there, or on the performance stations which you are doing or where you are performing on the examination. Then how to prepare for examination, which is your PG examination. Now remember, a PG examination is a different cup of tea than a UG examination. Okay, for a PG examination you might get, or usually you get in India, which is going to be called next instead of NEET PG now. It would have 4 options and 1 correct answer. Now these questions could be a problem based. These questions could be based on interpretations, and these questions could be based on creation of treatment plans. Here you are being tested for various components, that whether you are able to remember, that is recall, whether you are able to understand the concepts which is there, whether you are able to apply the concept which you have learned in pharmacology, whether you are able to analyze the scenarios of situations being provided to you, whether you are going to evaluate a patient's setup which has been given to you, and whether you are going to create a treatment plan for them. Same thing is going to be there in USMLE examination, and there it may not always be a 4 option 1 correct answer. There would be different variations which is there depending on what type of step you are appearing in, and there could be simulated patients, there could be volunteers over there, or you could be even artists who are masquerading as patients and who are going to be evaluating you over there. Now let's try to see a simple concept. We all know that carbamazepine causes syndrome of inadequate ADH secretion. Now, this is the concept which you remember from pharmacology. Now this concept, how a teacher can assess. If they simply want to assess your remembrance or memory, you could have a simple question that use of carbamazepine has been associated with the development of which. So there could be 4 options, and obviously the answer here is syndrome of inadequate ADH secretion. Now the same context can be complicated. How to evaluate your understanding for the same concept? So here you are being given a different scenario. A female patient is being treated for bipolar disorder who develops syndrome of inadequate ADH secretion. She is most likely being treated with. So it means first you need to understand what are the various bipolar disorders, what are the drugs which are used in bipolar disorders, and which among these can cause syndrome of inadequate ADH secretion. So again the options are the same: valproic acid, carbamazepine, chlorpromazine, and then clomipramine. Okay. So obviously sometimes you have a distractor. There are 3 with C and 1 with V. So you might think, okay, because it is different, so it would be, but the answer is not valproic acid, it is carbamazepine. Now looking at the same scenario in application. So here you are given a scenario, it is a big scenario. A Sunita 30-year-old female presents with complaints of nausea, headache, dizziness, fatigue. It is describing the manifestations and has become prominent over past 2 weeks. 6 weeks ago, she began appropriate treatment for disorder characterized by hyperactivity, insomnia, unusually happy mood, and the lab results are serum sodium of 110 milliequivalents and the range is given, serum chloride of 88 milliequivalents, the normal range is given, plasma osmolarity of 236 milliosmoles and the range is given, and urine osmolarity which is inappropriately concentrated relative to serum sodium. So here they have tried to give you a scenario. So there are 3 components over here. First, they have tried to give you manifestations of a complication which has happened. Secondly, they have given you a scenario in which you have to diagnose based upon the manifestation what is the disease. Thirdly, they have given you lab parameters which is to collaborate with the manifestations which have been described in the beginning, and then they are going to complicate it further by telling you that there is no evidence of dehydration, because it is very clear that there is loss which is there is a less of serum sodium which is there, and they have tried to rule out other causes which could be, for example, renal, adrenal or thyroid dysfunction. So they are asking therapy with which drug would be most consistent with the presenting problems which are there. So here, using the same concept, they are trying to take it further. Then coming on to another scenario, though this is not related with it, but I have tried to put it together as testing of analytical skills. So what you're given over here, you're given 4 drugs and you have been told about the effects on sodium, potassium, calcium, bicarbonate, and what is the ultimate or what is the effect on electrolyte balance. Drug A causes increase in sodium, potassium, no change in calcium, increase in bicarbonate, and it produces acidosis. Drug B causes much more increase in sodium, slight increase in potassium, a reduction in calcium. There may be no change or slight increase in bicarbonate, producing alkalosis. A drug C is causing much further increase in sodium, much increase in potassium, slight increase in calcium, no change in bicarbonate and producing alkalosis, and drug 4 or drug D is causing slight increase in sodium, reduction in potassium, no change in calcium, no change in bicarbonate and producing acidosis. So there are 2 situations resulting in alkalosis, 2 situations resulting in acidosis. Now they are going to ask you that what is the possible drug which could result in, or which could be possible drug which is producing effects, that is drug B. So this is a drug which is either inhibiting sodium chloride, co-transport in early distal tubule, inhibits carbonic anhydrous in proximal tubule, blocks sodium potassium 2 chloride co-transport in ascending loop of Henle, or inhibits carbonic anhydrous in proximal tubule. So here the answer would be inhibit sodium chloride co-transport in early distal tubule. Then coming on to evaluation, now looking up another scenario, here you have given another female patient who are presenting with the complaints of morning stiffness persisting for 2 to 3 hours, joint pains, weight loss and fatigue for the past 4 months. Examination revealed bilateral symmetrical swelling, tenderness, warmth of MCP joint and PIP joint and metatarsophalangeal joint of the feet. Lab investigation shows a slight increased ESR, serum creatinine of 2.5, X-ray film negative for tophi and showing soft tissue swelling of hand and feet. So therefore, what is the most appropriate treatment over here? Given a treatment with probenecid, prednisolone, naproxen and methotrexate. So here you are trying to treat a patient with these options. Then another is about creation. So again, I am coming back to the same concept of carbamazepine and syndrome of inadequate ADH secretion. So there's another patient, 30-year-old female, who presents with complaints of nausea, headache, dizziness, fatigue and confusion. After extensive laboratory tests, you conclude she is experiencing syndrome of ADH secondary to therapy for bipolar disorder. This patient is most likely being treated with, again, it is carbamazepine. So this is a very important thing. The same concept has been made at a higher levels of assessment. Okay, the concept for majority of these questions is that carbamazepine causes syndrome of inadequate ADH secretion when it is being used for bipolar disorder. And you can see how this would be. So it's very important to remember the theme. If you remember the basic concepts in pharmacology, you will be able to answer all these questions which could be coming up with higher levels of learning. Now remember, when you have to appear in pharmacology examination, you have to remember the basics. The first thing that you must try to master in pharmacology is general pharmacology. Please do not try reading something else before you have understood general pharmacology. Once you have understood general pharmacology, the next step would be to do autonomic nervous system, because this is very important, because this is the first logical step, because here we'll be talking about alpha receptors, beta receptors, we'll be talking about dopaminergic receptors, and therefore you will understand what are the various receptors, what are the transduction mechanisms, how expression of these receptors in various organs produces different effects. You also will be learning about muscarinic receptors, nicotinic receptors which are there, and what is the interaction when there is stimulation of sympathetic system, when there is inhibition of parasympathetic system, or when there is stimulation of dopaminergic system. And then there would be systemic pharmacology which would be associated with the clinical correlations. It could be talking about GIT, it would be talking about CNS, cardiovascular system, endocrinology, it could be talking about autocoids, chemotherapy is very important, okay, and then toxicology. But remember, these days, as I mentioned earlier, in CBME curriculum, it is no longer these topics. Rather, there are competencies which are given, and there are 64 competencies. Remember, a topic could be covering more than one competency. or a single competency could have a number of subtopics over there. And remember, you must not try to miss out on anything. Obviously, more emphasis would be on the major topics like CNS, CVS, endocrinology and chemotherapy, in addition to autonomic nervous system. So these are the major topics on which you are going to get questions on it. And remember, this could be expressed as a long answer question, short answer question, or even an MCQ, and this would be contributing for 95 marks out of 100. Please remember, when you're trying to read pharmacology, the best way to read is from your teacher's notes, because teacher is going to prepare notes from a number of books and they are going to give you a gist. Please remember, you as a student have to appear in 3 examinations in phase 2, that is pharmacology, pathology and microbiology. The teacher already has a number of years of experiments only in one subject. By virtue of this experience, the teacher knows which component is given better in which book, and therefore they would mix and match information from different books. They might even use resources from the library to give you a consolidated information, also telling you about the latest treatment guidelines, because as I said, one of the important application of pharmacology is in therapeutics. So they will tell you which is the drug of first choice, which is the drug of second choice, as per these guidelines, which could be international, which could be national, which could be state, depending upon what disease or what pathology you are talking about. Obviously, one important book which you can always refer to is by K.D. Tripathi, that is Essentials of Medical Pharmacology. The advantage for this particular book is that it is giving points. So those who have a good picture memory would always have those points. Please remember, whatever you learn, you are going to only remember 10% of it by the end of examination. So if you repeat and read again and again and again, and at least scribble with your paper, with a pen on a paper, it would really have some memory trace and it will really help you to answer. Then it's very important that how to manage the time. As you know that you are going to have 1 full year with phase 2, where you have to do your pharmacology, pathology, microbiology, community medicine. You have to have your clinical postings. There will be lectures on AdCom, pandemic module, then medicine classes, surgery classes and gynae classes. In addition to, you'll have some classes on forensic medicine also. So you will be having so many topics which you have to cover up in that. So therefore, it's very important, please do not miss classes. Remember, the curriculum has been made in such a way that that is integrated. So there could be demonstrations, which are very important. As I said, in pharmacology, there are 21 skills and there are 64 competencies on which you are going to be assessed. So skills are going to be for the practical, competencies are going to be in theory, and the concepts of these competencies would be also there in the practicals which are there. There would be integration which is there. One best way to learn pharmacology is from the patients. You already have a doctor-learner method where you are expected to go to the hospital in the evening from 4:30 to 6 o'clock. Please never miss this opportunity. Whenever you go to your clinical posting, you would be given a variety of cases. So once you have taken history, you have done general physical examination, you have looked at the lab parameters, you have done the systemic examination, you have made up a treatment plan, and you have pointers that this is the probable diagnosis, these are the differentials over here, and these investigation will help me to arrive at this diagnosis. Once that discussion is over, please have a look at the patient treatment chart. It will give you a unique opportunity to look at pharmacology in therapeutics. Look at what the patient has been given. There is a chance this patient might be given an antibiotic, it might be given an analgesic, might be given a drug for acid peptic disease, might be given a multivitamin preparation, might have some other drug which is being used for the ailment. For example, it's a diabetic, there could be anti-diabetic agent. If the patient is hypertensive, there would be anti-hypertensive patient. If the patient is having epilepsy, there would be an anti-epileptic drug. Patient is having gynecological infections, there would be some specific preparations for that. Patient is having eye infection, there would be some eye drops over there. Please make it a point to read about the diagnosis and the drug therapy which is there. So it means it will give you an opportunity. You are going to have at least 300 days which you will be going to the clinics. So 300 days you have opportunity to read about 300 diseases. The diseases may be repeated, and therefore you would understand for a same scenario. For example, you have a hypertensive. If a hypertension is having diabetes, so what is the choice of drugs? If a hypertension is having bronchial asthma, what is the choice of a drug? If a hypertensive is having migraine, what are the choice of drugs? If a hypertensive is having peripheral vascular disease, what is the choice of drug? If a hypertensive is elderly male having BPH, what is the choice of drug? Also look at the various permutation and combination which is there. So as I tell you, it is the best learning opportunity. Have a look at the treatment chart. In Dr. Learner method, you will be following up these patients during your posting. You can see what is the impact of this particular treatment. There would be chances when a drug has been given, it will produce some adverse drug reaction. For example, a patient is given amikacin and the third day you find that serum creatinine is rising. You will never forget this experience. If you remember what happened when the patient came on day 1, what was the serum creatinine and what is happening on day 3. If it is rising, you will also remember that amikacin is causing nephrotoxicity. You have a patient who was given penicillin and maybe on the third day the patient had a allergic reaction. So you will never forget that what allergic reaction looks like. You have a patient who has been given an NSAID and patient develops pain in the epigastrium. So this is gastritis which is there, or there is ulceration which is there, which could be seen on endoscopy. So this is one good way to learn it. If you think that you are going to just learn pharmacology by reading from the books, it is not the right thing. Until and unless you are going to cram up the things over there, this is not going to help. Remember, patient is the best learning source. But first, your mind must know what are the drugs. So your mind will know from what are the drugs being used. From your knowledge of pharmacology, you will see advantage. You will see that advantage of having that knowledge, that you would be able to see what are the drugs being used. Obviously, when you're going to be starting in pharmacology, one of the first topic which is covered is general pharmacology. So you must be posted in some department. At that point of time, you would not be talking about therapeutics. There you can lay emphasis on what are the various preparations, what are the injectables being used, what are the lozenges being prescribed, what are the syrups being given, what are the IV infusions being given to this patient, what are the tablets being given, how a subcutaneous injection is given, how intramuscular injection is given. So you can look at these dosage from how a patient is given instructions to use an inhaler, how a transdermal patch is being used, okay, how you monitor a patient who is undergoing anesthesia. So you would be posted on different things, how topically a agent is applied, okay, what is the difference between a cream, what is the difference between a lotion, what is the difference in a gel. So this all you will learn depending on where you are posted. And when you're going to talk about autonomic nervous system, there would be some sympathetic drugs which are being given to a patient might have a fall in blood pressure, you might be using an inotropic agent. Patient might have benign prostatic hyperplasia, you might be using an alpha blocker. Patient might have glaucoma, you'll be using agents on the parasympathetic system. Or this patient might be requiring neostigmine for bringing out of or countering the effect of neuromuscular blocking agents. So all these concepts, they are there. Obviously, as you complete your pharmacology, the postings that you're going to have towards the middle, from the middle to the end, you'll have more opportunities because by that time you'll be covering more of a systemic pharmacology. But nevertheless, pharmacology is something which keeps on evolving. So today what you have seen in the war today, it might be something different tomorrow, might be different in year 3, might be different in year 4, that is phase 3, phase 4. And therefore, never try to miss out on this opportunity. The most important thing to remember is that you must always read, read and read. When you are reading, please try to supplement your knowledge by using post-its. You can use various flow charts. You can use various treatment algorithms. You can use various descriptions of pathology or pathogenesis, which will give you sites of drug action. So all this will help you to do it over here. Please remember, when you're going to attempt an answer, always try to supplement with a correct flow chart, treatment algorithm, pathology, site of action of drug. Remember, as a teacher, I evaluate a number of answer sheets. Obviously, there's going to be a monotonous thing over here. What strikes me, or what really gives a good score to a student, is the one who has supplemented the answer. You could write different headings. I've told you there are 10 different headings for which you have to describe a drug. If you may not give headings, but you put a separate line for each of them. As a teacher, I would understand you are trying to give a good holistic view which is there. And if you can supplement your answer with a flow chart, with a diagram, with a pathology, with a site of action of a drug, it will really go in a long way. Please remember, as a teacher, I understand you would only be able to supplement your answer if you have basic understanding of this particular thing. As I said, it should be important that you should be using the correct flow chart. If you are writing a wrong flow chart, you might have written everything else, the teacher will not give you marks. So it's very important, be sure of what you are writing, supplement your answer wherever possible over there. Another tip to remember when you're going to appear in your examination. You have 3 hours to attempt your question paper. Clear? The first thing that you should do is just spend first 5 minutes to read the question paper after you have attempted your MCQs. Because MCQs you will be given a limited time. So once the MCQ part is over, then you spend just 5 minutes on reading the questions which are there. Just mentally try to look at the answer which is there. Use the last page of your answer sheet to scribble the points. It might be possible when you are scribbling, for example, first question is on sympathetic drugs. Let's say it's talking about what are the various sympathetic agents. Write a note on one of the sympathetic agents. What are the emergency uses of this sympathetic agent? And let's say somewhere you are asked rationale of use of epinephrine in anaphylactic shock. So there is a chance that shock is being covered under a different competency. Sympathomimetic drug is being covered under a different competency, and as you are writing over here, you might remember that one of the drug which is a sympathomimetic agent is epinephrine, and epinephrine is the drug of choice for anaphylactic shock. It is used in anaphylactic shock because of 4 reasons. So when you are just scribbling the answer, because this is on your last page of your answer sheet, it is not on the question paper, so you cannot be labeled as that you are cheating. If you write it on the back of your question paper and that unfortunately question paper goes to somebody else over there, it would be constituting as a breach of examination and you might be put up with the unfair means case. So it's always better to use it on the last page of your answer sheet, because which is with your name, which is going to be there with you. Just scribble these points with a pencil, and before attempting that question, please read through those points and see that you are able to remember and organize your thoughts and write it together. Remember, as compared to your seniors who were before 2019 batch, the paper was relatively having lesser questions. The marks were also lesser. They only had a paper for 40 marks. You are going to have a paper for 100 marks, out of which 5 marks are for ATCOM question, 95 is of pharmacology, which could have some component of MCQ up to 20%. Clear? So once that component is done, you still have relatively lesser time. So therefore, arrange your thoughts properly and then write it down. Please try to attempt your questions in a sequence. Do not write that this is question number 1, part A, and then you're starting with question number 3, part B, and then you're coming up with question number 5, part C, and then you're doing question number 1, part B. Please first try to attempt question number 1, 2, 3, 4, 5, 6, how many questions are there, and please try to give weightage to whatever marks are there. The same component of a question could be asked as a 2 marks question, a 4 marks question, a 5 marks question, and even a 6 mark question. So depending upon the number of marks which are attributed to that concept, you have to make it lengthened. Clear? I already have told you that you please remember the 10 things when you're writing about a drug. This will help you to ensure you have an answer which is adequate in size, which is taking into clearance or taking into consideration all the points which need to be covered for that particular drug. Now lastly, we are going to be talking about why DigiNerve is good for you and why we think that DigiNerve will help you to learn better. We are designing this program which is on competency based learning, and obviously, as I mentioned, this is what you are required to do as per your curriculum which has been devised by the National Medical Commission. The content is being delivered by experienced teachers which are having 20-25 years of teaching, and they really know their subject inside and out. So therefore, they would be able to highlight the points which are of importance to you. The concepts are going to be explained. So if you look at these lectures which are being delivered over here for you, you can see that there would be concepts which are made clear with using flow charts, concepts which are highlighting what are the important things, what are the important pharmacokinetic considerations, what are the important points in mechanism of action, what are the important adverse drug reactions, pharmacological actions, and when we talk about therapeutic uses, whether it's a drug of first choice, second choice, what are the various treatment algorithms which are there. Then there are certain case scenarios. We are not having, at least in my lectures, we are not having a case scenario based, but at least in these scenarios, I'm trying to explain it to you that this is how the patient is going to present to you. This is how you're going to be choosing a drug for a particular subset of combinations, which could be comorbidities, which could be a disease, which could be an age group, which could be a gender-based thing over here. Then we're also going to discuss with you what are the applied aspects. How do you choose a drug for a particular scenario which is there? What is the importance of knowing in which drug it can be combined, in which condition it is going to be contraindicated, which drug there's going to be drug-drug interaction, which foods there's going to be food-drug interaction. And the questions we are telling you during our lectures over here, which are being delivered to you, this is an important from your MCQ point, this is important from your spotting point, this is important as a long answer question or a short answer question or explained by basis. This is why this fixed as combination is available, this is why this fixed as combination is not available, and most important thing, this gives you an opportunity to learn at your own pace. Whenever you are free, you want to revise a chapter, you can just go through again. It is unlike a lecture where if the lecture is being held, you are physically present, it is fine. If you are not present, you will miss out that content. So here at your own pace, you can learn these topics, but my suggestion to you is that first do general pharmacology, then do autonomic nervous system, and then you can take up any system, because then the application, because when we are looking at CNS effect, we might say that this drug is having a sympathomimetic effect because there is a alpha stimulant effect. We might say that there is an anti-muscarinic effect. So you will not understand what does the anti-muscarinic mean. Anti-muscarinic means it is going to block muscarinic receptors. If you don't know what are the muscarinic receptors, so you will not be able to understand this, that when you block these muscarinic receptors, there is going to be dryness of mouth. When you block alpha receptors, there is going to be postural hypotension. So this is a very important thing that you need to remember. We are trying to bring the classroom to your tablet or to your laptop, and you have an opportunity to read it, listen to it, make notes of it, and repeat it as many times to understand these concepts which is there. I hope that this explains to you the need for using DigiNerve to supplement your teaching which is being given to you, or you are having it in your classes, which will help you learning with the use of books and will help you understand pharmacology as a subject. And as I mentioned, pharmacology is a very important subject. Once you have knowledge of pharmacology, you can very well attempt your questions in other specialties, whether it's medicine, whether it is surgery, whether it is eye, ENT, and so on and so forth. So please read pharmacology. Don't try to cram the things. What you need to cram is classification, but that can also be made easy if you understand the site of action. If you understand the chemical nature, you can arrange them in any way you want. So when you have a question on classification, try to write down that this classification is based on this criteria. You simply don't start it like that. It is based on mechanism of action, it is based on chemical structure, it is based on receptor affinity, it is based upon the use in a different indication which is there, or a type of effect like sympathomimetic effect which is on the blood vessels, sympathomimetic which is on the heart, and so on and so forth. So you can use different methods to remember it. You can supplement your notes with your information which you have taken from your books of your choice by putting paste it over, so that you have to spend less time when you're going to revise it. And obviously you have this DigiNerve, you can read again by looking at the presentations which are there recorded for you and try to remember these concepts again and again. I hope this is going to be helpful to understand pharmacology in a better way. Thank you.